Welcome to PodcastRx, a new monthly podcast from Diamond Pharmacy Services.
Each episode is a conversation with the men and women who make Diamond the nation's largest correctional pharmacy provider, Pennsylvania's largest independently owned long-term care pharmacy, and a trusted retail pharmacy and medical supply provider to many in Western Pennsylvania.
We chat with pharmacists, nurses, technicians, and other key personnel for a deeper look at the administrative, clinical, and logistical challenges of filling prescriptions and delivering healthcare, from our local counter to across the country.
And we also get the occasional glimpse into the professional journeys of our guests and why they chose the careers in pharmacy and healthcare.
With the legalization of medical marijuana and the growing popularity of over-the-counter CBD oil, many older adults are turning to these cannabis cousins to treat a variety of ailments. But what does the research say about their efficacy, and what risks might be associated with using them? To help answer these and other questions, we turn to Erica Gray, PharmD. She's a pharmacist in the Diamond Drug Information Center, and as you'll learn in this episode, something of their resident expert on medical marijuana and CBD. We delve into basic pharmacology, clinical concerns, use in the long-term care world, and much more. I'm Adam Campbell, and this is PodcastRx. Well, I'm here on PodcastRx with Erica Gray, PharmD. She is a member of our Diamond Drug Information Center, and we have her on the show because she gave a presentation recently at our Columbus, Ohio Educational Conference. For those of you who don't know what our educational conferences are, we've hosted those for about 15 years now. They're for the long-term care market, and we have our own speakers, Diamond personnel, give continuing education talks on everything from elder abuse to caregiver burnout, geriatric nutrition, things like that, things related directly to pharmacy, but also just in general long-term care health. Looking through the agenda, I saw a course titled Stirring the Pot on Medical Marijuana Use, and I thought, well, that's interesting how that fits in yet doesn't fit in with all these other courses. So have with us Erica Gray. She's here to talk about the presentation, to talk about the kind of clinical practice that she sees as a pharmacist in long-term care, but also generally in the Drug Information Center. And we're going to talk about that, and we're going to talk a little bit about the other big topic that's related to that, CBD oil. You see CBD everywhere. So really wanted to get a pharmacist perspective on this, especially a clinical pharmacist like Erica. So Erica, welcome to the show.
Hi, Adam. Thanks for having me here.
Well, thanks so much for being here. So the first thing I have to ask you, as this course you gave just a couple days ago in Ohio, Stirring the Pot on Medical Marijuana Use, what made you interested in this topic, presenting to a long-term care audience? I mean, like I'd said, we have these other topics like you would probably expect on the agenda: depression and anxiety in older adults. Mm-hmm. You gave another presentation on drug diversion, psychotropic stewardship, but then there's medical marijuana. What piqued your interest?
Yeah, so anytime in the Drug Information Center, we often see interest or trends in like where people are interested. So we were getting a decent number of questions about medical marijuana, THC, CBD, etc. So it was identified as an educational need. And I think that's where I kind of fit in. I was kind of new to the crew back whenever this interest kind of peaked. So they asked if someone wanted to do it. And I said, sure. So I offered to look into the topic of medical marijuana and CBD and present on them as needed for internal and external purposes. So I've kind of been like the medical marijuana and CBD person up in our Drug Information Center, following it pretty closely over the past year and a half now.
It's a very interesting role to have as a newbie.
Yeah, it is.
Well, I want to ask you, with this has become your topic of your area of focus. So as a clinical pharmacist, what does the clinical practice landscape look like for medical marijuana right now?
Yeah, I would overall say that the clinical practice landscape seems pretty complicated, just with everything going on as far as state regulation versus federal regulations. At a federal level, as you know, medical marijuana is considered a Schedule I substance. Therefore, it is considered a drug that has no currently accepted medical use and a high potential for abuse. And then we have other drugs in there. Think about like LSD, peyote, and heroin that are also considered Schedule I substances. However, at a state level, it gets a little bit complicated because we have maybe medical marijuana or recreational marijuana programs. So it's legalized at a state level for that medical purpose for a patient or recreational use for the general public. So this just brings into like a big legal question. So federally, it's illegal, but state level, it's legal. So that's definitely where it gets complicated. But I could give you a current example of how we run things kind of in the Pennsylvania medical marijuana program, if you think that that would be helpful for listeners.
Sure.
So the medical marijuana program in Pennsylvania gives the opportunity for patients who have qualifying conditions to register for the program. So what they do is they go online and register, and then they have to see a certified physician. And this certified physician, they're certified through the medical marijuana program, approves that the patient has a qualifying condition. And then that'll prompt the patient then to be able to register further and pay for their medical marijuana card. And then once they get their card in the mail, they can actually go to the dispensary. And then at the dispensary, there's healthcare professionals there. So they'll have physicians, it might be an NP or a pharmacist on board that can meet with the patient, talk about their qualifying condition, and talk about the different medical marijuana products and what might be best for them. So that's kind of how we run it right now in Pennsylvania. So you have your physicians in the outpatient setting that they'll see that'll permit them to get the card and then go to the dispensary, and then they see another healthcare professional there.
Okay. Now, you were presenting to folks in Ohio for the listeners. Now, was there a great bit of difference in regulations there?
Basically, it's the only difference between like the programs between Ohio and Pennsylvania that I noticed were that instead of the patients registering first, they go see a physician, and then the physician registers the patient, and then they get an email prompt. And then basically it's the same process. They get the card in the mail, go to the dispensary, and meet with a healthcare professional. There were less qualifying conditions in Ohio than we have here in Pennsylvania. So less conditions where you can get medical marijuana in Ohio. And then trying to think if there were any other differences. Those were the only key ones that I kind of noticed as far as that. The day supply obviously will differ between states. But overall, it seems like a pretty similar medical marijuana program with the Pennsylvania program.
Okay. Now, you mentioned the qualifying conditions. What are those qualifying conditions?
So the qualifying conditions for some examples that we have for Pennsylvania are like ALS, autism, cancer, Crohn's disease, ulcerative colitis, multiple sclerosis, Parkinson's, glaucoma, HIV, and AIDS is on there. Sickle cell disease, terminal illness, severe chronic or intractable pain of neuropathic origin. So you can see like a lot of different indications. This is not an all-inclusive list, but just a lot of things like GI indications, pain indications, ophthalmic like glaucoma, HIV, and AIDS. So a lot of different varieties of qualifying conditions.
I don't know a whole lot about this. I'm sure most of us who aren't don't have PharmD after our name do. But can you give a layperson's clinical explanation for medical marijuana? How does it work? Because I grew up knowing marijuana as this mystical drug that's not used necessarily for medicinal purposes. It's for many other things, but not that. But of course, there's a lot of interest. It's a very loud conversation happening in the overall healthcare world right now. So how does it work?
Okay. Yeah, that's a really good question. I think we're still exploring this too. So I'll talk about the cannabis as a plant first. So talking about cannabis, it is a plant. There's different species that you've probably heard of referred to before, like cannabis sativa or cannabis indica. Most commonly people know or have heard of cannabis sativa. So this cannabis plant can either be considered hemp or marijuana. When we talk about hemp, we know it's federally defined as having less than 0.3% THC. So low amounts of tetrahydrocannabinol. And federally, they count anything as hemp as a cannabis sativa plant that does not exceed 0.3% delta-9 THC by dry weight. Now, they define marijuana as the opposite. So anything that has greater than 0.3% THC or tetrahydrocannabinol. So you're hearing me say the words THC and CBD a lot. So THC, tetrahydrocannabinol, and CBD or cannabidiol or phytocannabinoids or plant cannabinoids, which is where we get them from the cannabis plant. Now just keep these in mind because I'm going to take a little shift. So in our bodies, we have something called the endocannabinoid system. Endo being in and then cannabinoid being these cannabinoids. So we have CB1 and CB2 receptors that were identified, cannabinoid receptor 1, cannabinoid receptor 2. And now these cannabinoids, THC and CBD, can actually interact with these receptors within our body. And this is how it's basically thought that they produce an effect, that maybe you have an imbalance in your endocannabinoid system and that having these outside cannabinoids coming in could affect that. So basically, these potential cannabinoids could have some theoretical effect in our bodies.
Okay. Now, the most popular conception of marijuana use is, of course, smoking it. But as far as when it's applied in a clinical setting, what other avenues are there for people to be treated?
Yeah, at the medical marijuana dispensaries, they have a lot of different forms. So inhaled is the one that you mentioned. Smoking, particularly vaporizing, is how it's recommended in Pennsylvania and what's actually legal to use it for. So you can vape dry leaf or vape liquids. And then there's oral formulation. So it'll come as like a capsule formulation. So someone could take it orally and swallow it. There's oral mucosal sprays or drops. You've probably seen the tinctures over the counter where it's the little dropper that people could put it under their tongue, or they could use a spray in their mouth. There's lotions, so creams, lotions, oils that you could put on the skin. And then patches are another common one. So thinking about how we have drugs as like a patch formulation that you could put on your skin. So all these are options that I've seen on different medical marijuana dispensary websites.
Now, you mentioned some of the conditions earlier that it's used to treat. What does the clinical evidence say about medical marijuana versus traditional medications? Right
now with medical marijuana, a lot is limited as far as knowledge that we have. We know that people are using it for pain and anxiety, migraines, nausea, things like that. But the evidence is pretty limited. And I think that all comes back to definitely the regulations and it being a Scheduled I substance. So we haven't really had the ability to study it. So recently now we'll be able to study it a bit more. It seems like the DEA is on board with allowing more people to research it. So overall, the evidence is pretty limited for medical marijuana. You might go to a dispensary, but they might have more experience with what they've experienced with other patients, but we don't really have good published literature right now is the big thing.
Yeah, it's interesting. One article that I reference here, or reference in my research, and this is an article called "Psychedelics in Seniors: Can Drugs Such as Marijuana and Psilocybin Improve Their Quality of Life?" From Forbes from September of 2019, notes that the American Medical Association does not endorse the use of medical marijuana. National Cancer Institute finds the research too inconclusive. This is what you alluded to. The American College of Physicians recognizes it as a treatment for glaucoma. The American College of Neurology supports it to treat symptoms of MS, and the Academy of Medicine says it may be helpful in treatment of some cancer symptoms such as nausea and pain. Mm-hmm. So obviously some big organizations weighing in, and there's some leeway toward, we can get behind it on some things, but in others are just absolutely across the board not recommending it. But do you see with the greater research opportunities, based on what we do know, do you see it expanding? And between that and just, personal taste, it was a lot of people.
Yeah, I think that a lot of people are pretty unsure about it right now, as you can see across the different organizations. It seems that either the organization doesn't endorse it or some organizations endorse research because they want that published literature so they can tell their patients yes or no and give them more of a defined answer rather than I don't know, it might work. Which is kind of where we are right now. So hopefully with more research, we can give our patients a better understanding of not only does it work or doesn't work, but what side effects we should expect for that particular disease state.
Yeah, it's anecdotal.
Yeah.
A lot of things are just anecdotal with respect to this. We're going to take a little break now to tell you a little more about the Diamond Drug Information Center. On a personal level, we all appreciate when our pharmacist gives us a thorough consultation for a new or complex medication. They dispense not only the drug, but important information about dosing and possible interactions. This kind of medication counseling is easy to understand on a personal level, but what about on an institutional level? Where do healthcare providers, especially those delivering care to large populations with diverse needs, go when they need medication counseling? Enter the Diamond Drug Information Center. The pharmacists of the Drug Info Center dispense in-depth clinical consultation for all of Diamond's customers, from correctional facilities to nursing homes. This team of PharmDs specializes in pharmacotherapy and disease state management. And if you have questions about dosing, drug-drug interactions, non-formulary medication requests, therapeutic alternatives, or you just need general clinical advice, they're a call away. They also take proactive steps to educate healthcare professionals. They issue regular clinical updates, and they develop webinars and presentations about specific drug topics. You can reach the Diamond Drug Information Center at 800-882-6337, extension 1834, or email them druginfo@diamondpharmacy.com. And now back to PodcastRx. You mentioned side effects. What can you tell us about potential side effects with medical marijuana? Also, are there drug interactions that you have to worry about?
So going back to the cannabinoids, talking about tetrahydrocannabinol or THC, it's associated short-term with dizziness, drowsiness, dry mouth, euphoria, impaired short-term memory, impaired motor coordination, altered judgment, and confusion, and even paranoia and psychosis. Whenever really high doses are used, patients could even hallucinate. Long-term is addiction, altered brain development, and cognitive impairment. If it's used in early adolescence, have been noted. And then chronic bronchitis, obviously, if someone's smoking it, and then increased risk of chronic psychosis in patients with a predisposition to such disorders. So if someone has an uneasy psych history, you probably want to avoid something with THC because of these psych risks. CBD, on the other hand, cannabidiol, is more associated with somnolence, fatigue, lethargy, decreased appetite, diarrhea, transaminase elevation, so liver function tests come back abnormal or high in patients. And this is based on what was seen in the Epidiolex or cannabidiol. It's the FDA-approved medication that is derived from cannabis, that is cannabidiol, which is used for seizures and severe seizures in children like Dravet's and Lennox-Gastaut syndrome. So that product particularly gave us pretty good insight to what we should expect to see from CBD. Now we also have to think about all the drug interactions too, as far as THC and CBD. So the cannabinoids are metabolized by the liver, specifically cytochrome P450 enzyme, which is where a lot of medications are metabolized. Therefore, the levels of prescription medications can change in the body, going up or down, for example, which could make the prescription more potent or even more toxic or less effective on the other hand. So you have to think of it as disease state management. It could really affect the patient's disease state. If they introduce something like THC or CBD and it does interact with their medications, they might not get as good management or really potent side effects from their medications because of the increased exposure to the medications. There have been also case reports of a common drug called warfarin, which is monitored using INRs. It can affect INR levels going up or down. So you probably want closer look at INR levels if someone starts this. The CNS depressant effects, as I talked about, THC can cause the dizziness and drowsiness, and then CBD can also cause some somnolence and fatigue. So you could have additive effect with other CNS depressants, anticholinergic effects, which is like dry mouth. So THC causes a dry mouth effect, which could be exacerbated if they use a THC product and are on anticholinergics. And then lastly, protein-bound medications. CBD and THC are highly protein-bound. So your plasma can bind drugs, and this THC and CBD can displace those drugs. So by doing that, it'll increase the concentrations of those other drugs in your blood system, which could give you more side effects. So there's a lot of potential for drug interactions. So I always recommend if someone's going to start a marijuana product, let your physician, pharmacist know, or really meet with those people at the dispensary and show them your medication list so that they can, educate you on potential drug interactions.
And of course, everything you just went into detail on versus the fact that there's not a great body of research, and that I think that underscores the need at the very least for more research.
Mm-hmm. Yeah, I definitely think there is a huge, huge need for more research whenever it comes to THC and CBD products. We know a lot from the Epidiolex product now as far as drug interactions go, but definitely THC in the different forms than what we have that are FDA approved. It would be great to see more studies on those other formulations and potential for drug interactions.
How does medical marijuana or CBD work with like pre-existing conditions? What kind of literature is there on that?
Yeah, I think that there's probably some warnings that I would give people as far as who should be on the lookout for these products and who should probably avoid these products. So acute psychosis and unstable psychiatric conditions, we kind of talked about this before with THC. I'd probably avoid THC-containing products in this population if they're not stable on their medications, or if they do have an underlying condition that is cyclic and isn't well managed. And then other ones that I would consider cardiovascular disease, people with a history of MI or arrhythmias, for example, myocardial infarction or heart attacks. I would probably recommend that they avoid THC-containing products because THC can cause tachycardia and hypertension. So if you have a cardiac history, this could increase your heart rate and it could cause you to have a higher blood pressure. So you probably want to avoid those types of products. And then immunologic conditions. So CBD and THC are known to have effects on the immunologic pathway. So patients with immunologic conditions, I usually try to say, like, don't rock the boat is the big thing with these patients. Sometimes it's really hard to get them stable on a medication. Thinking about Crohn's disease and ulcerative colitis specifically, or rheumatoid arthritis, once you have them on a medication and they're stable, you really want them to stay stable. So I definitely kind of say don't rock the boat on these patients. So I'd probably avoid it, especially if they're stable. And then respiratory diseases, it just makes sense. Any inhaled formulations you'd want to avoid in patients with disease states like COPD, asthma, cystic fibrosis. And then lastly, liver impairment and renal impairment patients. So our patients that, maybe have cirrhosis or have kidney diseases, there's a lack of studies in these patients. So we don't really know how this drug will be metabolized properly in this patient population.
Now, another thing you did talk about, there is actually 4 FDA approved drugs. Can't say it for me. Cannabinoids.
Cannabinoids. Yeah.
Thank you. So you mentioned Epidiolex.
Epidiolex.
All right. There's also Marinol, Syndrose, and Sesamet.
Yeah.
Sesamet. Okay.
So yeah.
And those, I found that surprising that there are. I mean, for as much as you hear about this controversial medical marijuana or anything based around cannabis, that there are these other medications out there that are approved.
Yeah.
Can you talk a little bit about those and what those are?
So the FDA approved medications that we have are Marinol and Syndrose, which are the dronabinol synthetic THC products. Marinol is the capsule formulation and Syndrose is the oral solution formulation. Both of them are approved for anorexia associated with weight loss in patients with age and nausea and vomiting associated with cancer chemotherapy in patients who have failed to respond adequately to conventional antiemetics. So there are anti-nausea medications. And then we have Sesamet or Nabilone, which is also a synthetic THC product. And this one is only approved for the nausea and vomiting associated with cancer and chemotherapy in patients that have failed our first-line therapies. And then the other medication, which is new to the market that was approved in 2018, is Epidiolex, which is a cannabidiol product, which is an oral solution. And this is a purified CBD product. It's actually derived from cannabis. And it is FDA approved for Dravet syndrome and Lennox-Gastaut syndrome, which are 2 very severe seizure conditions, typically in pediatric patients.
That's what I found most interesting with that is, and we'll get into the talking more about the sort of over-the-counter CBD oil a little bit later, but that there are these, FDA grade drugs out there. It just seems so different given what CBD oil is. You're seeing that being used for versus these conditions. I found that quite interesting.
Yeah. So a lot of the times whenever you look at Cochrane reviews or systematic reviews, you're going to see these products actually the ones primarily used in the studies because they're FDA approved. Mm-hmm. So they were able to be used whenever they did the research. And these are the products that probably have more of the evidence backing them. or the products that have INDs, investigational new drug applications that are actively being studied for different indications too, will be the ones primarily with most evidence behind them.
Switching gears a little bit, and looking at this topic, the subject of opioids also came up. And I'm going to quote directly from this Wolters Kluwer blog that titled CBD Oil and Medical Marijuana, Pharmacists Need to Know the High Points. And a section there says that a 2018 study of Medicare Part D claims found patients in states that allowed medical cannabis filled significantly fewer doses of opioids compared to states without legal medical cannabis. The effect was strongest in states that provided medical cannabis through dispensaries, where opioid prescribing decreased 14.4% compared to states without legal medical cannabis. In states where medical cannabis was accessible only through home cultivation. So what's your take on, as a clinician, what's your take on that, that there's that reduction? Is that...
Yeah, I don't think we can fully say that one is linked to the other. I think they're all observations. We also have to think that we're in an opioid epidemic is another thing. So the CDC has really been coming down on decreasing opioid prescribing, which could be a confounder to those studies. So that's another thing I would really have to worry about. How many states had initiatives to decrease opioid prescribing in them whenever they did this study would be another thing that you'd probably want to look at. I'm not saying it doesn't decrease opioid use, but there are other studies that have shown the opposite as far as whenever it comes to opioid overdoses. That's the bottom line. You know, we may be prescribing less opioids, but we're still seeing opioid overdoses.
Just more from this blog, studies of opioid overdose deaths have found decreased rates of overdose death after legalization of cannabis in Colorado and throughout the United States. Interesting fact here, in the 2 years following legalization of recreational cannabis in Colorado, opioid-related deaths decreased by more than 6%. In another study of the United States from 1999 to 2010, states allowing access to medical cannabis had a 28.4% lower mean annual opioid overdose mortality rate compared to those states that do not allow access.
Yeah, on that study that you quote from 1999 to 2010, they actually redid that study. Another group went and re-looked at the study and did it up until 2017. So they went from 1999 to 2017. And what they found was actually an increase in overdose deaths. So it did decrease from 1999 to 2010, but then it went back up. And the percentage of people, I believe it was 22.7% increase. Can't quote me on that, but I believe it was around a 23% increase in opioid overdoses. So, you know, it's re-looking at statistics a lot of the time. That study looked great. The 1999 to 2010, it looked really promising. But then whenever we saw the reevaluation of the data and we saw the increase in opioid overdose across the states that had laws that allowed medical marijuana use, it just was pretty astonishing. And then there have been systematic reviews too that have looked at multiple studies that have looked at opioid overdoses or opioid prescribing, and things have been pretty inconsistent. They haven't been able to say, yes, it does decrease opioid prescribing, and yes, it does decrease opioid deaths. We don't really know if it's doing anything with opioids. I've heard that people are not using opioids in place and using, a medical marijuana product. So I honestly don't know. I think we need a little bit more research to figure out what's going on with opioid prescribing and opioid overdoses.
Yeah. Certainly with things of this nature, you can't have enough research.
Yeah, definitely.
Not at all. So I wanted to circle back to the topic that got us talking about all this in the first place, and that was your presentation for the educational conferences. You've done a couple on medical marijuana topics this year, one most recently in Ohio, and you gave another one or two, I believe, out in our Pittsburgh and Lancaster conferences. Correct me if I'm wrong.
Yep, that's correct.
And so when you're speaking to these audiences from the long-term care world, so these are folks from skilled and personal care, administrators, nurses, runs the gamut. What kind of things were they asking you? What kind of conversations were you having after the class about medical marijuana in their environments?
Yeah, I think a big question that they have, especially for administration, is policy development. So a lot of institutions have made their policies available online. So you can look at, for example, institutions that don't permit medical marijuana in their facility or institutions that permit medical marijuana, and then all the policy development that goes behind it as far as what qualifying conditions they'll allow within their institution, who will actually bring in the medical marijuana from the outside, who's going to be administering the medical marijuana, how will it be stored whenever it's within the facility, and what if they don't allow it into the facility and then a patient brings it in to their facility. So they have a lot of questions about policy development. And I always say consult, your legal team whenever you develop this policy because of the gray area around medical marijuana within the United States right now. So that's one of the big things that they always ask. And then they'll ask other questions. I try to educate them as much as I can on what evidence we do have, but they'll ask about different indications. I've gotten questions on Parkinson's, where we don't have a lot of evidence, Huntington's. Pain management is probably the biggest one where I get questions. Topical formulations is definitely another area where they are inquisitive.
Sure. And I can only assume, and this is a very broad assumption, but as more and more baby boomers get to be in these care facilities, that there's going to be more questions about using medical marijuana. Just again, this is a general statement, but that a lot of, and I've seen it in some of this research. There's a lot of boomers that was a drug that was very much in vogue when they were young people, and has had these medical or therapeutic benefits touted for years, and now are seeing legalization in some states. But it seems like that's going to just grow in terms of the questions asked among providers. Would you agree with that?
Yeah, I think it's becoming more and more popular. I think it'll be a really interesting thing if it recreationally, specifically in Pennsylvania, if it becomes legalized, then I think there will be a lot more utilization. But yeah, and I always try to tell people that the marijuana back when the baby boomers were around is not the same as the stuff that we have in the dispensaries. There are definitely, if you actually look at a product, very, very specific percentages as far as like THC content, cannabidiol content. And then there's also other cannabinoids within it too that they have percentages on. So there's it's a whole new thing.
Thanks so much for listening to PodcastRx, a production of Diamond Pharmacy Services. While we're taking a break here, we'd love it if you took a moment to follow Diamond on one or more of our social media platforms. On the corporate end, you can follow us on Twitter @DiamondPharm, connect with us on LinkedIn via our Diamond Pharmacy Services company page, and also subscribe to our Diamond Pharmacy Services YouTube channel. Our long-term care division has a Facebook page, and you can find that at facebook.com/DiamondPharmacyLTC. They also have a LinkedIn showcase page. Just search for Diamond Pharmacy Services Long-Term Care Division. If you're a listener in our hometown of Indiana, Pennsylvania, our retail drugstores and medical supply stores also have a social media presence. Find them on Facebook, page name Diamond Drug Stores and Medical Supply, on Instagram @diamonddrug.medsupply, or you can subscribe to the Diamond Drugs YouTube channel. We really appreciate your support of the podcast and would appreciate your likes and follows on these social media channels. Now back to the show.
We're back here on PodcastRx with Erica Gray, PharmD, talking medical marijuana and also CBD oil. Now, I have to ask a pharmacist's perspective on this. I have so many questions. CBD oil, you see this everywhere. Of course, working as part of the marketing team here at Diamond, and looking at pharmacies here in town and elsewhere. I mean, they've got so much marketing materials devoted now to CBD oil, but it doesn't end at just the drugstore counter. You can go to the video store and get it. You can go to the convenience store. What I want to ask you, and to help make sense for the listeners, is what separates this CBD oil from the more, we talked about Epidiolex, that being an FDA approved cannabinoid medication, but what people are using this CBD for a lot of ailments, and just want to help. I want to understand it a little better. What is being put out there, and what kind of decisions should people make to be more informed consumers?
Yeah, I think this is a really, really good point to touch upon. So I think one of the biggest things is For example, the Epidiolex product goes through a lot of manufacturing processes to make sure it's pure, it's safe for patients to take. So there's a lot of testing that goes behind it. Now these over-the-counter, I'll call them over-the-counter CBD products, the ones not coming from a dispensary, is basically probably should be derived from hemp if it's over-the-counter, because we know if it's marijuana, it is considered a Schedule I substance federally. If it's marijuana, it should be coming from a medical marijuana dispensary if it's legal in that state. So a big thing for people to look out for is where is their CBD derived from if they're getting it over the counter. So is it coming from marijuana or is it coming from hemp? Hopefully, if you're getting it not from a dispensary, it is hemp derived. The next thing that you probably want to look at with the CBD products is it's called a COA, or confirmation of analysis. And basically what this looks at is different tests that look at potency, terpenes, residual solvents, residual pesticides, heavy metals, and microbial analyses, and even like fungus. And it basically tells you how pure your product is, as far as is there anything in it that you don't want in it. So, for example, the potency is going to tell you how potent the product is with CBD content. It'll also tell you if it has like THC in it. So it'll tell you how pure it is. And then things like residual solvents and residual pesticides, you have to remember that these products are derived from a plant. So to actually get the CBD out of the plant, it has to go into a solvent and it has to be extracted. And then as far as pesticides, it's a plant grown from the soil. So there's the risk for pesticides, heavy metals, those funguses, and those microbials that could grow on the plant. So you just have to think about all the ways that you could have a contaminated product. It could be dangerous for a patient. And then lastly, one of the things I would probably recommend is that you make sure your product doesn't have like a false claim on it. So for example, cures cancer or treats pain. You don't want to see that on a product, mainly because they can't have claims. They're not FDA approved products. So these are considered false claims, which is illegal. And then of note, I just want to mention the study. I don't know if you saw it. There was a study that looked at 84 online CBD products. Did you happen to see that one?
I did not.
And it actually, it was published in 2017, and they found that 43% of the products were underlabeled. So for example, I usually explain this as it has 50 milligrams when it said that it had 100 milligrams. And then 26% were overlabeled with CBD, basically saying something like it had 100 milligrams, but it only had 50 milligrams. So explaining that a lot of these products were mislabeled. So 69% is a pretty high percentage of products whenever you think about it. So I always just try to tell people to make sure if you're going to use a CBD product, just make sure it does the testing, and it doesn't just do the testing once, it does batch testing on their products, that it's hemp derived if they're getting it over the counter, and then it doesn't have false claims.
So in some ways, it's a lot like just in general taking any kind of supplement. Supplements, of course, aren't regulated by the FDA, but you know there could always be other things in them that, not what's on the label. So largely the same caveat emptor, I believe.
Yeah. I think that's like a huge thing with any supplement. So supplements could get like a USP, United States Pharmacopoeia seal. Typically, pharmacists will recommend these because we know they're being tested for what's actually in the product. So we know that what's on the label is actually what's in that product. Right now, we don't have that for these CBD products. We just have that COA. So hopefully they're doing the COA. The COA is appropriate, but there's no real regulation on it right now as far as what tests should be done and which tests are recommended. It's ruled based on a state level what's supposed to be done, but not every state has laws right now.
I believe there's a push for some within that manufacturing community to want that FDA oversight. Is that correct at all?
Yeah. So right now, there was an FDA meeting. So the FDA has released statements on what they recommend for CBD products. And basically, they believe in science-based, evidence-based medicine. So right now, there's not evidence-based medicine or science-based medicine for CBD products. So what the FDA did was they had like a day-long meeting back in May, and anyone could come to this meeting and you had to apply to present, and they presented information on marijuana or CBD. And then they had a portal online where people could submit publications, could submit any type of evidence that they believed was important to this portal. And then the FDA was going to look at it. So right now, it's kind of like the FDA is a little bit in the hot seat. We're waiting to hear from them as far as what they believe or what they think we should do with these CBD products, whether they should be a dietary supplement, should they be a food additive, or something else altogether. So we're just waiting to hear back from them. Hopefully, I'm anticipating end of the year, but maybe first quarter next year, we'll hear something at the latest from them.
I do want to ask, we mentioned it in the earlier segment, just talking strictly medical marijuana. Is CBD oil something that's coming up? These over the counter, is that coming? I should say, are these over the counter CBD products coming up in conversation with long-term care providers that you've met at the conferences?
Yeah, I think it is something people ask about, the CBD products. I had, someone say that they used the CBD and it worked for the patient for pain, but yeah, they definitely ask a lot of questions as far as, I know we didn't have it in our computer system for a while, so we've added it now so we can actually track to see, what type of products that are being used for these patients, whether it's like a topical cream or a tincture or capsules for these patients. But I know it's being used, but I don't know how often it is being used as far as that goes for our patients.
And I assume some of the concerns you mentioned earlier with medical marijuana, you're going to have a lot of overlap with the over-the-counter CBD stuff too.
Yeah, I would worry definitely because it is CBD, and we talked about adverse effects before. Those adverse effects you probably should expect to see with these over-the-counter products. And also the drug interactions are huge, which I often worry about with our long-term care patients that have a lot of medications, that have multiple comorbidities. So I always, express caution whenever using with these patients, and more of an approach to make sure it is an okay product, and that, this is actually what the patient wants to do.
Overall, in your estimation, what do you think the future looks like for, aside from research and the questions that we answered, that there needs to be more of it, but CBD oil in particular, just given the sort of hype that surrounds it, do you think it's here to stay, and that it's going to be a real player in how we treat people with different ailments, or is this just kind of a fad right now?
So I think that CBD within the next, 5 to 10 years, I expect acutely to us see the FDA kind of come out with some kind of statement on it and give us a little bit more guidance as far as the public on what to do with these products. That's number one, probably the best thing. And then I think the next thing that we'll probably see is more studying of CBD products. Basically, the DEA recently stated that, hemp is hemp. It's not considered a Schedule I substance anymore. So hemp and its derivatives, and in the memo that they had, it did state cannabidiol, that they're not going to regulate it. So we should probably expect to see some more clinical studies coming out with CBDs.
We have to pause here to add some clarification to what Erica just said. The DEA statement Erica just referred to was a press release titled DEA Announces Steps Necessary to Improve Access to Marijuana Research, and it was issued August 26 of 2019. In the fifth paragraph, the release states, quote, "The Agriculture Improvement Act of 2018, which was signed into law on December 20th, 2018, changed the definition of marijuana to exclude hemp, plant material that contains 0.3% or less delta-9 THC on a dry weight basis. Accordingly, hemp, including hemp plants and cannabidiol preparations at or below the 0.3% delta-9 THC threshold, is not a controlled substance, and a DEA registration is not required to grow or research it." Back to the show.
So within the next probably 5 to 10 years, we'll see some more research on it. Different formulations, definitely more as far as, what's happening with these products. So that's what I would expect to see. Maybe we'll have more solid information within the next 5 to 10 years on, where to go with these products.
Well, certainly if we have another podcast episode on the topic, we know you're the designated person for it, and we look forward to you interpreting those new rules and guidelines for us. So, Erica, thank you so much for being on PodcastRx.
All right. Thank you.
This podcast features conversations with healthcare professionals. Their statements and opinions discussed herein are for informational purposes only. This podcast should not be considered professional advice and should not be used as a substitute for the advice of an appropriately qualified and licensed healthcare professional. Therefore, listeners must not rely on the statements made herein.
PodcastRx is a production of Diamond Pharmacy Services, the nation's largest correctional pharmacy provider. Find new episodes of the show on SoundCloud, Stitcher, and Google Play. And please subscribe, share, and leave us a review. Music by Maximiliano Silvera, sound expressed by Getty Images.